Big news this week, guys. The heads of 4 major federal agencies, including the ones that oversee SNAP, Medicaid, and housing assistance, have announced a plan to enforce strict new work requirements for millions of low-income Americans across all the major assistance programs. They say that these rules will restore dignity and protect the truly needy, but critics warn that these changes could strip benefits away from people who are already working, or from people who qualify for an exemption but just can't prove it through all of the new red tape. So if you rely on SNAP, Medicaid, TANF, housing help, or other benefits, you need to see this. We're going to walk through what's actually happening, who's at risk, and what you can do right now to protect yourself and your family. But before we get into all those details, do you support mandatory work requirements for these programs? Drop a quick yes or no in the comments so that I know where you stand. And now let's get into it. First, we're going to talk about what's actually happening and how it might affect you. So what we're seeing is a very massive public push from top officials in the Trump administration, including the heads of USDA, HHS, HUD, and the CMS, which is the Centers for Medicare and Medicaid Services. They recently published a joint letter in the New York Times saying that adults who get these benefits should work at least 20 hours a week. They say there's plenty of jobs out there, so there's no reason that people shouldn't work when they can. And you might be thinking, yeah, we've heard this before, and you're right. This isn't the first time that they've said this. Just last month, the USDA told states that it was time to enforce work rules. They warned that waivers wouldn't be as easy to get anymore. But this time it's different, and it's not just SNAP. The leaders in charge of these 4 agencies oversee the largest and most important assistance programs in this country, and they have come together to say point blank, quote, at the Departments of Agriculture, Health and Human Services, and Housing and Urban Development, we are ready to implement work requirements, end quote. They are ready to start enforcing these rules right now, even without any new laws or other changes. The idea is fairly simple on paper. If you're an able-bodied adult without dependents, you'll need to work, volunteer, or attend job training at least 20 hours a week to keep getting those benefits. But that means that millions of people could lose their benefits, not because they did anything wrong, but because they missed a form, had a gap in hours, or just couldn't keep up with the paperwork requirements. So if you've ever worked part-time, had your hours cut, or had to care for someone at home, this could hit you harder than you might think. We're going to walk through what you can do to protect yourself here in just a minute. But first, let's talk about who's most at risk for this. If you're between 18 and 64 and you don't have a documented disability and you're not caring full-time for a young child, this could potentially impact you. And here's the scariest part. Even if you do qualify for an exemption, you could still lose your benefits if you don't file the right paperwork at the right time. So if you work part-time or seasonally, you could be at risk. These rules require 20 hours a week. So if your job gives you fewer hours or cuts your schedule, you could lose your benefits, even if you're doing the best you can. If you care for someone at home, like an elderly parent, a disabled spouse, or a sick child, you might also be at risk, especially if you don't have formal paperwork or legal proof of what you're doing. Now, I know the rules are supposed to apply to able-bodied adults without dependents, but there's already talk in Congress of implementing work requirements for parents with children as young as 7. So parents with special needs kids, or those who are immunocompromised or facing chronic health challenges like my daughter is, could be put in the impossible situation of losing their benefits just because they're unable to get to work. Now, if you have a disability, but you haven't finished the paperwork to be officially approved for a disability program, the system might not count you as exempt. You could still lose those benefits even if you medically can't work. And if your work hours or your income change often, like for gig workers or people with unstable jobs, keeping up with all the forms and reporting rules could trip you up, even if you're technically following all the rules. So in short, if you rely on SNAP, Medicaid, or housing help, and you've ever lost hours, changed jobs, or had to take care of family, or struggled with paperwork, this could affect you. Not because you did anything wrong, but because it's complicated. We've already seen the way this played out in Arkansas. In 2018, when the state tried a Medicaid work requirement, 18,000 people lost their coverage over the course of just a few months, and most of them lost that coverage wrongly. CBPP estimates that 95% of those who were affected either met the requirements or qualified for an exception, but they lost anyways. benefits. In Georgia, a recent Medicaid expansion included a work requirement. The state estimated that 240,000 people would qualify, but only about 5,500 actually got coverage, and it cost the state over $13,000 per person just to sign them up. A man in Georgia who was featured in a state video promoting these work rules lost his Medicaid coverage twice, even though he was working both times. Why? Because of the red tape. This is not efficient. This is harmful. And it's because these requirements are so complicated. There's a lot of paperwork, a lot of red tape, and it's easy for you or even the workers at the benefits office to make a mistake. The people pushing for these changes say that the rules will save the government money and push more people into work. But we have to ask, do these rules really help people get jobs, or do they just take help away from people who actually need it? Let's look at what the data says. First of all, the vast majority of people who get SNAP or Medicaid are already doing their best. About 64% of adults on Medicaid are already working, and most of the rest are caring for family, attending school, or are medically unable to work. With SNAP, over 80% of households with a working age adult had earnings last year. The data is clear. Most people who can work already do. Many are juggling low-wage jobs with unpredictable hours. Others are caring for family members, dealing with health issues, or attending school. They're not avoiding work. They're surviving in a system that's already stacked against them. These new rules don't just target people who are not working. They punish people who can't prove that they are. This includes gig workers, people with undocumented disabilities, or anyone who's easily tripped up by red tape or confusing online systems. If you miss one form, fall a few hours short, or get locked out of a website, you could lose your food, your housing, your healthcare, and those are serious consequences. That's why experts are warning that these rules don't solve the problem, they create new ones. And what's worse is that they don't even work. Arkansas kicked 18,000 people off of Medicaid and saw no job gains. Georgia spent over $13,000 per enrollee and saw no clear job gains. The Congressional Budget Office and others have confirmed that work requirements reduce benefits, not unemployment. And honestly, that shouldn't surprise anyone. Nobody is living off of Medicaid. It doesn't cover your food, your rent, your gas. It just helps people get the medical care they need to keep going. Let me give you an example. If you've followed this channel for a while, you know about my daughter's health struggles. What you might not know is that her aunt has a very similar condition. My daughter has excellent health care, not through Medicaid, but through something else. And that's what allows us to pursue specialists and treatments so aggressively. Her aunt, on the other hand, doesn't have access to that kind of care. Her health struggles make it hard for her to work, which makes it hard for her to get good health coverage because most health coverage comes through your job, which then makes it hard to get any sort of treatment, which makes it hard to go to work, which makes it hard to get health care. And she's caught in this doom cycle, not because she's unable to work, but because she can't get access to the care that would help her work. This isn't unique to my family. I know many of you have been through the same thing or are going through that right now. Healthcare shouldn't be a reward for working. For many people, healthcare is what makes work possible in the first place. So when we tie basic care to employment, we leave behind the very people who need help the most, not because they're unwilling to work, but because they can't without the care that they need. So what can you do? If these new work requirements move forward, and it does look like they are going to push forward quickly with this, there are a few things that you can do right now to protect yourself and your benefits. First, apply for disability if you're eligible. If you have a disability that isn't officially documented, now is the time to take that step. I know a lot of you are scared to apply for SSDI because it's hard to get, and most people get denied the first few times, and the paperwork is overwhelming, but you can't afford to wait anymore. These new rules could cost you the benefits that you already rely on. So reach out to our sponsor, Injury Claims, at the link you see on screen. They'll help you fight for your case, and they only get paid if you win. Their job is to make it easier for you to get what you deserve. And while you're applying for SSDI, go ahead and apply for SSI too. It's often easier to qualify for. It can help cover the gap and help you start getting some sort of disability documentation. Second, find a place where you can work or volunteer. If you can't work a paid job, volunteering or job training still counts toward those work hours. Take a few minutes this week to look around your community. Look for a food bank, a school, a church, a local nonprofit, somewhere where you could get those hours if you had to. Even if you're not starting now, that's fine, but you're going to want to know where to go if these rules hit you. Third, watch out for notices. If you become affected by these rules, you should receive a letter in the mail or a message through your online benefits portal. Don't ignore those. Open every piece of mail you receive from the benefits office. Take them seriously, respond on time, and don't miss any deadlines. Fourth, learn about and document any exemptions you may be eligible for. You may be exempt if you're caring for someone, dealing with health issues, or already working enough hours, but you'll probably have to prove it. Gather doctor's notes, caregiver letters, or anything else that shows your situation clearly. Prepare now so that you don't miss any deadlines if and when you need that documentation. Fifth, keep records of everything. Start tracking your work, training, or volunteer hours now if you're doing that. Even if the rule doesn't apply to you yet, just form that good habit. And then if it ever comes up, you'll already have what you need. And sixth, get help if you need it. Don't try to do all of this alone. Legal aid, nonprofit groups, and benefit advocates are out there, and many offer help for free. If you're overwhelmed, reach out. You can always call 211 to connect with an organization in your area that may be able to help you. I know this is overwhelming. I know this is scary, but you're not alone. And the more you know, the better prepared you'll be when these changes take effect. You've got this, and we're here for you. So if this video helped you, please share it with a friend or a loved one who might be affected. And don't forget to check out our other videos for more ways to save money and get free stuff.